So Unit 1 then is both a knowledge and a competence unit. It's the communication and care settings unit, and to achieve this in full, you're going to have to do some assignment work and have an observation from your assessor. So 1.1 then is asking you to identify the different reasons why you communicate. And within your answer, you need to look at and explore all those reasons as to why we communicate in your own work setting. So for example then, during a handover, what's the purpose of that handover? Well, it's to share information, to ask questions, to clarify any misunderstandings about the information that's been shared. What's the reasons we communicate on a day-to-day basis? What's the reason your resident communicates with you? It may be to share ideas, to express needs, wishes and preferences. Communication is also essential to build and form relationships, to explore feelings. So within your answer, ask yourself, what's the main purpose of communication and why do we communicate on a daily basis? And link that answer to your own work practice. So 1.2 then is asking you to look at how effective communication affects all aspects of your work. What you need to look at within this answer is the impact effective communication has on the quality of your work. So for example, if we communicate effectively as part of that team, we're able to build up trust, build up that rapport, establish a relationship amongst professionals and achieve that common goal, achieve that continuity of care for our residents. We're able to meet the needs, wishes and preferences of that resident because we're communicating effectively as part of that team and working again towards that common goal, i.e. the care plan. Effective communication allows us to prevent misunderstandings amongst the team. So again, we're all working towards that common goal, we're all achieving the same thing. It allows opportunity to reflect, learn from mistakes, and promote change and development amongst the team. It also aids in negotiation, resolving conflicts, and building effective relationships amongst others. So 1.3 then, you've got to explain why it's important to observe an individual's reaction when communicating. Now, me and you both know elderly people are often reluctant to give you information, often afraid that it might lead to an hospital admission, so at times may give you false information or be reluctant to give you information because of that fear of going to hospital. So that's really why it's important to observe an individual's reaction when communicating, because they may not understand, they may give you false information, they may be reluctant to give you the right information to prevent going to hospital, to prevent that GP appointment. Often elderly people think they're a burden on people and like to be very independent. So their body language might suggest that they've not actually understood or that they are reluctant to share the right information. So it's really important that you observe them, observe any visual cues, observe their body language, because it may suggest that they actually don't understand, that they are reluctant to give you that information, and that they do need further help and support. So 3.1 then is asking you to identify barriers to communication. And by identify, you can just do this in the form of a bullet list. You do need to cover a range of barriers in order to pass this assessment criteria in full. Now, barriers to communication could include physical barriers, such as underlying medical conditions like dementia. With dementia, they've got that inability or that cognitive impairment to be able to process and retain information. That in itself is a barrier. It may be a language barrier. So within care, we use a lot of abbreviations or acronyms, such as DN for district nurse. When speaking to a family member or a resident, they may not be able to understand that abbreviation. It's okay amongst professionals because we understand. But when speaking to residents, it can then provide a barrier to communication. There may be environmental barriers such as noise or lighting. That's having a knock-on effect to be able to communicate effectively. There's a range of barriers out there, so within this answer, you need to explore those barriers and explore how you're going to reduce barriers to effective communication. So 3.4 then asks you to identify sources of information or support to effectively communicate. Now within this answer, what you need to look at is the support, advice, the information that's available to enable you to communicate effectively. So you may have an internal policy that explains the procedure for communicating effectively. The care plan in itself may have a communication profile to enable you to communicate effectively with that resident. There's services out there such as the speech and language therapists, the translation services, advocacy services that can provide information, advice, guidance to enable you to communicate effectively. You may need to speak to an individual's family because they've obviously known them a lot longer than you have, and they can provide information on supporting you to communicate effectively with that resident. Perhaps looking at working alongside more experienced members of staff so you can learn from them and learn from their experiences, ask them questions about how to communicate effectively. Consult your manager. Your manager's always available to provide information, advice and support. 4.1 then asks you to explain the term confidentiality. All you've got to do within this answer is give a definition of confidentiality and explain how you meet a confidentiality agreement in your own work practice. So 4.3 then asks you to describe situations whereby they would normally be confidential, but on this occasion may need to be passed on. So if you can think about your internal whistleblowing policy, we know that from a safeguarding point of view, when there's suspected or actual abuse, we know that we don't keep that information confidential. We know we have to inform that resident or that member of staff or that member of public that we need to share that information in order to safeguard that individual from that abuse. So that would be an example of when information that would normally be kept confidential would have to be passed on. So 4.4 then asks you to look at or explain how and when to seek advice about confidentiality. So if you felt there were a particular breach in confidentiality agreements, how would you seek advice and when would you do that? So you may need to look at your internal policy on confidentiality, look at what agreements are actually in place, and if you feel there's a breach in that, how would you seek advice and when would you seek it? So you could seek advice from that policy, as I've already said. You could seek advice from your manager, and you would seek advice when you felt that there'd been a breach of a confidentiality agreement.